We are back with you, and so happy to have you with us here on the HealthCall Live Radio Hour. Dr. Tom Lazoff from Physical Medicine Consultants has stepped in. If you have arthritis pain that is so severe, the supplements and other things in the first half hour we talked about just aren't helping anymore, you wind up seeing Dr. Lazoff quite often. How much of your practice is related to arthritis treatment?
In some form or fashion, Lee, about 50%. If somebody even gets hurt at their job or whatever, they do have, underlying arthritis that they may have riled up as a result of that. Or if you're walking your dog and you trip and twist funny, you may rile it up as well.
Yeah, funny. Arthritis is the inflammation cycle starts and the tissue damage begins, and man, you just got to get a handle on that.
Correct.
So you have a number of strategies to do that. Walk me through the sequence. When I see you, where are we likely to start, and then we'll go to the most advanced treatment you can offer?
We take a look at the patient and making sure you have the right diagnosis. Just because somebody has osteoarthritis in their knee doesn't necessarily mean that all the pain's coming from their knee. They can have referred pain from their back, and so we want to make sure we have the right diagnosis. Then from there, if somebody tells me that they, spin around on their head 5 times and it works and it gets rid of their pain, that's great. Less harm that way. And like Greg said earlier, start with all these other things because they don't cause as much harm as the anti-inflammatories and such. So we may recommend physical therapy or movement, as he called it, I believe. Mm-hmm. Also bracing to start out with. It just depends. And you have to remember that you have to attack this with a variety of different things. By the time they come to see us, they've been through different things, but maybe just singly. So maybe they've had therapy, maybe they've had topicals, maybe they've had some bracing, but maybe not all together. Mm-hmm. So we do that first. Then we take a look at what other medications can we use? Well, obviously, we shy away from narcotics anymore. In the old days, when Darvocet was around, we would, treat an 80-year-old individual. They'd take 1 a day, and they were fine. Well, we don't do that anymore. So we may look at a medication like Cymbalta, which is FDA approved for the treatment of arthritis. It's an antidepressant, but they have FDA approval for that treatment. Now, again, every patient's different, so you need to make sure that they're able to tolerate it and it has no other drug interactions. And I agree with Greg in the fact that NSAIDs are kind of dangerous for blood pressure, especially as we get older, GI issues and kidney issues. Then we jump into, then we start to get a little bit more invasive. So if you come to me for the first time and your knee is painful and swollen, we may try to aspirate the inflammatory fluid out and then inject cortisone, for instance. However, cortisone injections in particular on a routine basis probably not the best thing for a joint because there's studies that indicate that it where there's more wear and tear of the joint over a long period of time.
So let's talk about cortisone for just a few moments then. Its primary role is to get that inflammation under control, correct?
Correct.
And once you've got that in place, it's going to last how long?
That's the $1 million question. So it may last somebody a week. It may last them 6 weeks. It may be one and done for a number of years. Everybody's a little bit different. Okay.
And the risk of those are, I think, bone loss, right?
Correct. You can get osteoporosis, avascular necrosis, where there's deadening of bone tissue, particularly in the hips, and it can lower your immune system as well.
So I've had the cortisone injection. Now the pain is coming back. What's next?
Let's say it's your knee. Then we consider what we call viscosupplementation or Hyalgan injections. So this is a derivative of chicken combs. It's injected into the joint. There's products out there that you can inject once, sometimes 2 or 3 times, 1 or 2 or 3 times in a row, and that provides lubrication and may make the synovial fluid a little healthier, a little cushioning, so to speak.
And the real issue, I guess we never really talked much about the mechanics of arthritis, but in general, you've got cartilage that has eroded, been damaged by inflammation, and is just wearing away, right?
Correct.
And so that's where a big source of this pain is. And the acid injections, the hyaluronic acid injections, what is that doing inside the joint, other than, as you just said, lubrication? But is it doing anything to help restore or rejuvenate the cartilage in any way?
Not necessarily the cartilage. It's more the synovial fluid, so you're getting better cells of the hyaluronic acid. And then, but that tends to wear off over the course of time, and so that, because that stuff doesn't stay there for long periods of time, so then it wears away, and then you're kind of back to maybe doing that again down the road, and it's expensive as well. But you use that treatment to for a year, and then come back another year later, have another round of injections of this, because it's not really going to hurt the joint.
I see.
As the cortisone would.
Okay. And while I've got this, the injection on board there, is there anything else that you're doing for me at that time, or is it just that alone typically? Are you layering things?
We can layer things. So somebody might be on low-dose Cymbalta. They might have use the topicals. Again, the goal is to minimize the potential for side effects and bad things to happen to patients. And so, for me, for instance, if I'm going to go clean my garage out, I might medicate with some anti-inflammatory medication for a day or two, but only take it for that weekend, and then I'm off of them again.
Yeah. Okay, that's an appropriate use. So we are talking with Tom Lazoff, Dr. Tom Lazoff from Physical Medicine Consultants, and if you want to be part of the conversation, if you have a question about your severe arthritis pain and what treatment might be available, you can jump on board at 800-333-1190, or the local number is 447-1190. Text as well at 46862. If I'm a diabetic, and so many people are, how does that complicate your treatment options?
Well, diabetics obviously are more susceptible to kidney disease, so I would definitely not prescribe an anti-inflammatory in those individuals because they're going to be at risk for that. And then diabetics, then I would look more towards a medication like Cymbalta, depending on their situation, because they also have neuropathy, and Cymbalta can help neuropathic pain as well. So, and then you just have to be careful. I mean, you want to promote good health. You want to promote movement. That'll help their blood sugars and potential complications down the road, bracing, etc.
Yeah, that movement thing, hard to, the physical therapists that I've spoken with always use the phrase, motion is lotion for your joints.
Correct.
So, but it's that awful cycle that Greg mentioned, right? Your joints hurt, so you don't want to move, and then you gain weight, and all of that just keeps piling up.
Correct. Yeah, the people can't exercise because they hurt.
Right. We're talking with Dr. Tom Lazoff from Physical Medicine Consultants about coping with your severe arthritis pain. We've been through a couple of steps up the ladder as things keep going, and now we're going to talk about an injection therapy that is really kind of out there on the cutting edge of things, regenerative medicine, and it comes in two forms. So where are we going to start?
We can start with the stem cell, actually, and platelet, and I'm assuming you're talking about platelet-rich plasma.
Right.
And so if we have somebody with knee arthritis or hip arthritis, we may start with, but eventually get to the point for stem cell therapy. So you have to remember that, somebody's really bone on bone, and all these other things have not worked. Surgery may be indicated. If somebody's has at least a little bit of joint space left, then we can use stem cells, where we actually take your own bone marrow, process it, and then inject that into the joint. And what that is doing is telling the tissue there that, hey, you're going to become cartilage, or you're going to become a tendon, or you're going to. They don't know what they're going to be actually when you take them out, but when you put them back in, you're putting them in that environment, and so it makes the tissue healthier. And so far, so good as far as everything is concerned with results. So
you have done how many of these procedures, stem cell?
We've done, I believe, like 130 or 140 now.
And what's been the outcome? How are patients responding?
So far, 75% success. Now, success is different for everybody, right? It might be somebody that just needs to get up a flight of steps every day without having pain, or being able to walk their dog without any pain, or exercise. And I've done, a number of my friends who have been able to exercise as a result of all of this.
Yeah.
And the gentleman that called in a number of weeks ago, he's back to doing everything he ever wanted to do at age 76.
Pretty hard to beat that.
Yeah.
So again, you are taking stem cells out of the bone marrow, concentrating those, and then implanting them back into that joint.
Correct.
And isn't that amazing? Those little stem cells just know what you need.
Correct. Yeah. They're circulating in your system, but they're just too diffuse and not concentrated, like you said. And so, like, even if you injure your elbow today and your body then tries to heal itself, but sometimes it comes up short just because of the volume of cells needed to do that. And here you're concentrating them, getting, millions of little cells together and sticking them into the joint.
Remarkable. That just fascinates me. And then platelet-rich plasma is kind of a cousin to that, right? So you're taking my blood and spinning it up, and what's happening there?
So the platelets sort of direct traffic, so to speak. So they're helping with inflammation and recruiting cells to come to that area to heal itself, basically. So a lot of times for arthritis, we're going to use the bone marrow aspirate for stem cell. For something like a tendinitis or a bursitis, we would then veer towards more platelet-rich plasma techniques.
And who's the perfect candidate for that procedure?
You.
Okay.
Yeah.
Well, no, that's a good point.
Yeah.
So my knee is stiff and all that kind of stuff. Takes a while to get it going in the morning, and I'm worried that it's just going to keep getting worse and worse.
Right. So the longer you don't do anything, whether it's exercise, and watch what you eat from the inflammation aspect of things, you run the risk then of having that deteriorate even more rapidly. So you'd be an appropriate candidate then for regenerative techniques to help that knee.
And then is this a one-time only? How long does it last? What are some of those factors?
So far, we've been doing this for almost 3 years, and some of the studies indicate that this could last 5 years, 10 years. I mean, the jury's still out, and so what we're hoping is happening is we're delaying that surgery. Eventually, but then things get a little complicated as we get older medically. So everything depends on the patient. However, saying that 5 to 10 years is what we're looking at. It's not going to reverse anything. It's just going to make that tissue more healthy. But you still have those problems. Right. So it's going to happen again down the road, and we're just delaying that down the road.
Gosh, the surgery we keep talking, you've mentioned a few times here, we're typically talking about joint replacement, so hip implant, knee implant, that kind of thing. Those are happening so frequently today, and people, they're so successful often, but man, I don't want to go through that if I don't have to.
Correct. And there's, in our practice, we see a skewed view of the world. We see individuals who don't do well after surgery, and there are a ton of good surgeons out there and a ton of great outcomes. So I'm nervous just because if and when I have to have that done, and so that's why I'm going to go down this road for the stem cell, because once parts are in, that's it. That's a one and done scenario typically.
Yeah, there's no going back on that one, is there?
Yeah.
Okay, so if I've still got pain and I'm not bone on bone, so I'm not really a good candidate for surgery, there's another procedure that you can do that actually causes damage to nerves to relieve the pain.
Correct. That's called a rhizotomy or radiofrequency ablation. So if somebody even has had a knee surgery or knee replacement, or they're not a candidate and they're bone on bone, there's a technique that burns essentially burns little nerves that supply the knee joint. And it's not, you're not going to not be able to feel your knee. You'll still feel your knee, but then it eliminates some of the pain signals to the brain. And so you're killing off these tiny little nerves, which we do in the spine as well, for arthritis of the facet joints. And so we're burning these tiny little nerves, and that seems to work as well.
And that process is kind of interesting because you do sort of a test run first, right? You inject some numbing conditionings?
Correct, just numbing medicine, no steroid. We go and we inject 3 of the nerves that supply the genicular nerves that supply the joint. And if the patient has a successful trial, so to speak, then we can go forward and burn those nerves. So we want to make sure that that's where the pain's coming from, right, and that the procedure will be successful.
And what's that process like? So you inject me and then I'm numb for, am I up and walking around and say, yep, that was it, that does it?
Correct.
And then how long does that numbing condition last before I come back and actually have the procedure?
Well, I'm not going to tell you exactly because we give you a pain diary, and you have to write down your pain levels. I mean, typically it lasts anywhere from 2 to 4 hours, basically. Okay. But we give you a pain diary, your activity levels during that time, and obviously right then and there we try to reproduce your pain and document that.
Okay, I gotcha. And then the actual procedure, do I feel anything while you're burning the nerve? That sounds pretty frightening.
Everything gets numbed up pretty decently. Some patients choose to do it at a facility where they can have happy juice, we call it, Versed, conscious sedation, or we could do it in our office, and it's not terrible.
Okay, and then what's that recovery procedure like?
Not bad at all, because everything's done through needles, so to speak. So the recovery, you may not notice immediate pain relief. It may take weeks before those nerves actually, technically die off, mm-hmm. and so it may be 4 to 6 weeks before you really start to notice the pain relief. But there's really no long term. Maybe for a couple days you're a little sore, but other than that, it shouldn't be that bad.
And then how long does that procedure last?
Well, little nerves can grow back, and so that can last anywhere from 6 months to a year to, forever. It just depends. If you can interrupt that pain cycle, just like you're trying to do with topicals and other medications and injections, if you can interrupt that pain cycle long enough, then maybe you can get over the hump, and it may last forever. But typically, nerves grow back within 6 months to a year.
When do I need to see you? When is it too soon, and when is it too late?
Well, I don't think it's probably never too soon to see us. As far as, I would try some of the more simpler things, over-the-counter medications, over-the-counter topicals, CBD, curcumin. I mean, all those are beneficial. I take those as well. So, and if those don't work and you're frustrated and you're still not getting anywhere, then come see us sooner than later.
And then I know you do a lot of work with workman's comp and on-the-job injuries. Mm-hmm. How many people are actually you see being disabled because of arthritis and that kind of a problem?
A lot. If we take like us, I mean, let's say you're in your 50s or 60s and you already have a ton of arthritis present and you have an injury, it's almost like the straw that broke the camel's back, and then you just have a lot of difficulty then getting to that point. And of course, if somebody's had a manual job their whole life, now what do they do? They're kind of stuck.
Yeah, that is a tough one. Hey, we have to leave it there. That is Dr. Tom Lazoff. He is one of the doctors of physical medicine consultants. You can find them at pmcrestore.com. That is pmcrestore.com. And the site at which you're going to learn more about the regenerative medicine, the stem cell and platelet-rich plasma treatment is fwregen.com. All right, there you go. We hope that you learned a little bit about arthritis, and if you're in pain, we provided a number of different solutions. I hope you'll do something other than just keep popping pills. There are a lot of choices out there, and everybody needs to get off the couch and get moving, and we hope it helps. We'll see you next week.